talking about birth control. It is very important to be educated on the topic of birth control, especially females. Um, it's good to know what's best for you. It's good to know what your body can handle. It's good to know just all the different types of methods that are available towards you. So first is, what is birth control? So birth control is defined as any method that prevents pregnant. There are many different forms of birth control. We'll talk about them in a minute. Some include like a shot or like a patch or an IUD. Some are you do by yourself. Some you have to go to the doctor to see. Some are a little more permanent. So there are a lot of different varieties of different methods, which is nice. Next up is, our slide about methods of birth control. So the birth control implant is an implant that goes in inside your arm. It's going to go in over here. The IUD is going to go inside your vagina. It's kind of like a little T shape. Next up is the birth control shot. You're going to get that done by your doctor. We have the vaginal ring, which you'll do it by yourself. The patch, which you'll do by yourself. The pill, you'll do by yourself and do daily. The condom, and the internal condom. The diaphragm, sterilization, and a vasectomy. So starting off is our more permanent methods. So that's going to be sterilization and our vasectomy. Sterilization is for women. It's mostly referred to as getting their tubes tied. So these tubes don't get sperm in them, so they can produce a baby. So that no longer happens. And then the vasectomy is for the male, and for him, that allows the sperm to no longer produce the sperm and put it into her, so they can't have a baby. Normally the vasectomy is a little bit better of a procedure. It's less downtime for the male, and I'm pretty sure it says 99%. Yes, effective for the vasectomy. Next up is the ones that you have to do on the schedule. So we're going to start off with the birth control shot. So this is the injection. I think you get it every 3 months. So this will pump a hormone into your body that allows you to not have your period. And normally the way you know that it's time to get a new shot is when you have a period. So if you start having a period, then you know that it's time to go get your shot done again. Next up is our vaginal ring. This goes inside of your vagina, and you'll put it in there by yourself. It stays good up to 5 weeks. And then the birth control patch, which will be attached to places on your body. And then the pill is pretty strict on the schedule. It should be the same time every day. You should make sure that you're eating before too. So normally if I take my birth control pills, I try to be on strict schedule of every morning after breakfast, so you know that you're good, you're ready to take on the day. But you have to make sure you're doing it at the same time every day. And the shot is 94% effective. The ring is 91%. The patch is also 91%, and the pill is also 91%. Next up are the birth control implants and the IUDs. So over here is the IUD, and then on this side will be the implant. These are both forms that go inside of you, and both forms will be done by a doctor. So the birth control implant is a little rod that goes into your upper arm, like I mentioned earlier. You can stay good up to 5 years. It isn't a permanent change. You can get it out whenever. But this one is 99% effective, which is way up there. The IUD is in a small T that is made of plastic. It's pretty flexible and it goes inside your uterus. This is most recommended by doctors, which sits at 99% effective. Methods that can be used every time. So these are something that you have to do every time that you should be taking action. The condom stops the sperm from entering the uterus, and this also prevents STDs. We also have an internal condom, which is more for females, and then the regular condom is for males, which these are at an 85% rate. Next up is the diaphragm, which is a silicone cup that covers up the cervix that prevents you from getting pregnant, and that is done every time by yourself. What do we want to consider? There's quite a few things that you want to consider. Most of them are all personal considerations, like when do you want to have a baby? Do you want to have a baby? Do you have bad periods? Just so many different things that kind of play into a factor. If you want to have a baby in the next 2 years, then you really shouldn't be getting like on the IUD that lasts up to 5 years. Like that's for more of a long time. So if you're not planning on it, then I feel like that's a more suitable option. But if you're planning on getting pregnant like soon, or I just feel like the patch, the pill, something that's a little more in upkeep, so you can get on that. Also, a top priority is your health. Is birth control even good for you? Do you need birth control for your health? So many different factors there. The last thing you should take consideration is how many times that you are actually having intercourse. If you are constantly having intercourse, then the effective rates might be a little bit more top priority for you. If you're not, then the effective rates are all pretty high in themselves, so that shouldn't really be worried about. But also, it should be recommended that no matter what form of method that you use, you should be using a condom to prevent STDs, because none of these others do. And then finally, we have this quiz that I want y'all to take, so y'all can figure out what is best for you after figuring out all that educational things, so you can figure out what